first of all, let's see how the heart works. Okay, turn off the phones. Now, to be able to understand the cardio, you must be able to know the disease, the diagnostic test, right? The diagnostic test can be blood tests, machine tests, plus the disease. Can you please put these in this for me, because I have water and I'll drop it on the phone. Take another stool and put them there. Okay, please. Right? So, you have to know the disease plus blood tests, machine tests, right? Machine tests, disease, blood tests, machine tests, meds, intervention, NIC with the meds, and NIC with the disease. That is what we call med surg. For example, you need to know the patient have coronary arterial disease. You need to know what is the disease, what blood test did the doctor look at to figure out you have this disease, what machine tests, what medication I give for this disease before I give you the medication, what teaching I do. Now, once you find out what teaching for the medication, you also need to know what teaching for the disease. For example, what diet, how you going to position the patient. That is what we call med surg. Any question? Cardio, you already learned EKG plus drugs. You already know the cardio drugs, but we don't know the disease yet, and we don't know the blood test and the machine test. Any question? Now, with that said, welcome to the heart. The heart has 4 chambers: right atrium, right ventricle, left atrium, left ventricle. The most important part of the heart is the chambers that are closer to the body. And the body is here. You, me, I call us Yaya. Okay? Yaya. Okay. There's kids Yaya, there's adult Yaya. Meaning, cardio disease is in children and cardio disease is in adult. But you see these cardio disease here, these are disease in adult. Cardio disease in children are your ASD, VSD, PDA, not PAD, PDA, TOF, RF, and Kawasaki. Because, guys, what disease Gamun have is not the same disease kids have. The disease children have is not the same disease adult have. But if I don't fix this, it will go to heart failure. If I don't fix this, it will go to heart failure. If I don't fix this, it'll go to heart failure. If I don't fix this, it'll go to heart failure. So the last resulta is heart failure. Right? Kids don't just have hypertension. Kids have a disease that brings them to hypertension. But Simun, so you understand, you cannot say cardio, you cannot say cardio. You got to say peds cardio, adult cardio. They still med surge. But it's med-surg cardio for Gramoun, and it's med-surg cardio for kids. Any question? And right now, we're doing adult med-surg cardio. Ready? Let's go. So Miss Sonia told you about the chambers of the heart. Did the heart have what we call valves? Valves. I call valves immigration. The reason I call valves immigration is a migration job only lets, if you have the right paper, you can come to America. Meaning, so how does immigration works with the heart? If you the right kind of blood, you can come into the heart. For example, this valve is called tricuspid. This valve is called pulmonary valve. This valve is the most important valve in the heart, and it's called mitral or bicuspid. This valve is called aortic valve. And this big box is called aorta. Now, if there's a problem with the valves, how do you know if there's a problem with the valves? The patient will have a murmur. Anytime there's a problem with the valve, the patient will have murmur. Miss Sonia, why is aorta big and aorta is important? Why is it so important? First of all, the aorta is near the left ventricle. The aorta job is to have a pressure in here that is called ejection fraction. And this pressure got to be so strong that it push blood to get me from head to toe. Your normal ejection fraction is 55% or higher. Any question? Now, Miss Sonia, what is the job of the heart? The heart, as you guys know, is a big muscle. The heart job is, well, the lungs job first is to receive the dirty blood that comes from the heart, right? So the body takes this dirty blood. Anytime the blood gets to the body, the blood is called deoxygenated blood. So the blood is dirty. The blood has to go through the heart, through the lung, and go back to the body. So let's go. Yaya, which is you, me, baby, also. The heart works the same as for a little kid, right? So yaya, right atrium. What kind of blood goes here? Dirty blood. So if clean blood come here, immigration tricuspid close. Why? Because on the right side of the heart, you cannot have clean blood. So it goes like this. Yaya, dirty. Anytime it goes to the body, it's dirty. Solid. Now I'm going to send it to the heart to get clean. So look. Right atrium. Tricuspid say, come in, you dirty blood. Right ventricle. Push it to the pulmonary valve. Now, what kind of blood is in here? Clean or dirty? Dirty. Dirty. The pulmonary valve push it in the lungs. So the lung find gain, bleach, and wash the blood. The blood is called what now? Oxygenated blood. It goes to left atrium, mitral valve, left ventricle, aortic valve, push it to the aorta, build pressure, and throw it from head to toe. Any question? Again. Yeah. Right atrium. Come in, dirty blood. If this blood was clean, tricuspid would have closed and push it right back to the body. Right? Tricuspid, right ventricle, pulmonary valve, lungs. It's not pulmonary valve have a right to send it to left atrium. C'est lungs qui voyait to left atrium. Left ventricle, aortic valve, push it to aorta. It has to go through the aorta. If the blood did not go to aorta, what happened to the patient? Am I? Not am I. Think. Look. If the blood did not go through the aorta, how would the patient look? Don't go deep. Keep it simple. How would the patient look? Pale, weak. You know why? Because the patient will get blood, but the patient will not get blood from head to toe. You got it? Any question? So, Miss Sonia, what are the diseases that can happen? Here it is. CAD, bull grease, arteriosclerosis, writing. Angina, chest pain. But this chest pain can be for several reasons. Douleur, this chest pain can be clot or grease. We don't know why. So, CAD is arteriosclerosis qui relève boule grease. Angina can be, we don't know, it can be a clot that causes it or grease. But there's some kind of blockage. You with me? Am I? The tissue is dead. Heart failure. Is it a bull? What's wrong? Pumping problem. Good job. Now, here. You see how the medication come in. Keep your eyes open. You see where I'm going with you. Bull glass, you know what to give me. Bull sang, you know what to give me. I'm focusing on the drugs, right? Endocarditis, infection. Stay with me. PAD, peripheral arterial disease. What is that? It's arteriosclerosis that preventing blood to what? Flow in the lower what? But it's still a heart problem. All right. So we're going to say blood flow problem. Okay. Hypertension, right? Pressure, high pressure, AAA. High pressure that is caused the artery to stretch and may péter, right? Now, Lichtenberger disease. Blood is not flowing because I smoke. So we're going to put lack of blood flow. Okay? And renal disease, lack of blood flow. Okay, class. Because Miss Sonia already told you what type of disease they are, couldn't you figure out which drug go with what? Again, listen. Because I told you, qui qualité disease, Pour médicament montre hier yo. Est-ce qu'on pas connaît qui médicament kala avec qui ça? Okay, créole là non. Right? So right by looking at the chart, you already know what disease, what drug go with what. Any question? Now, right? One disease I didn't put here, valve disease. Okay. Now, Miss Sonia, show me how these diseases affects the heart. The first one, I'm going to use a red marker for boule glace. True? So, let's go. CAD. We're going to put that, oh, this red one gave up. CAD. Ooh, right here. I'm on page 680. Watch. CAD is atherosclerosis. That's boule glace, a plaque. Right? Let's go. Ready? Yaya. Ready? Yaya. Right atrial. Right ventricle. Push it here. Long, push it here. Now, think. That glass, the grease is on the heart. Is blood gonna flow? Is no blood gonna flow? Or she gonna get some blood, but just not a lot? Some blood, but just not a lot. So, how is the heart beating? Fast. So the patient is tachycardia, right? And how is the body? Is it hypertension or hypotension? Hypotension. Right? Because look, she's getting some blood. She just not getting a lot. Any questions? Stay with me. Now. So the patient is tachycardia, hypotension. Let's go to the CAD, 680, right? The disease, okay? 680, coronary arterial disease is a narrowing obstruction of one or more artery due to what? Atherosclerosis. This disease causes decreased perfusion, right? Now, what can cause this? The disease can cause decreased perfusion and eventually will lead to hypertension, dysrhythmia, MI, heart failure, and death. Right? Now, right here, number 2. Listen to what I say. MI. How would the patient get the MI? The increased blood pressure. Look. When the patient have the CAD, this hypertension has nothing to do with the sign and symptom of CAD. You understand? It tells you if we don't fix this, these are the other diseases the patient will have. When the patient has CAD, blood not flowing. So you cannot be hypertension because there's no what? Blood. This is telling you, si nous pas ranger, mais son pain gagné. Comprendre? Sign and symptom. Look, data collection, chest pain, palpation, dyspnea, syncope, cough, excessive fatigue. So how would the patient be hypertension if you excessive fatigue? Comprendre? Understand? If I don't fix it, these are the things that can happen. That don't mean when the patient has CAD, you have hypertension, because it don't make sense. The anatomy don't make sense. You got it? You cool. You comprend. Now, what is the EKG on this patient? Right? Something is sitting on the artery. What's the EKG, which is a diagnostic test? The first diagnostic test has to be what? An EKG, because the patient going to say, I have what? Chest pain. Now, because the patient is getting some blood, ST will be what? Any question? So the first diagnostic test for CAD machine test is an EKG. That's the first test, right? Now, because I want to know to tell the patient they have this disease. So we're going to do EKG, ST will be depressed. Blood test. I'm going to do a cholesterol test. I'm going to check HDL and LDL, which is called total what? Cholesterol. Now, HDL, right, you want higher than 55. Or some books say 60. LDL, you want lower than 110. Both together should be less than 200. Any question? So when you have CAD, Miss Sonia already told you the machine, one machine test, one blood test so far. Any question? Now, there's a test I'm going to do because the patient has chest pain, and I don't want that chest pain to be MI, so I'm going to do another blood test. And that blood test that I'm going to do is called cardiac enzyme, troponin, myoglobin. Why? Not because the patient has MI. I want to rule out MI. Any question? Again, the doctor will do cardiac enzymes. And I'll go in later on when I get to MI to tell you the difference between troponin, myoglobin, and the other one. Right? Now, any question? So, the patient say, doctor, you did the EKG and it shows ST depressed. You did a blood test that showed some cholesterol issue, right? You did the cardiac enzyme because you want to rule MI. I need to see if it's GLES for real, doctor. I need to know that what you telling me I have is grease. I need proof. I am going to do a diagnostic test called cardiac catheter. And let's go to it. It is 679. Oh, 672. 672. It is called cardiac catheter. I need proof parce que you did GLES, you did all of this mess. I need to see what you tell me is GLES. I need to see what it is. It's called a cardiac cath, and you're going to put, I cannot push piercing door without knowing cardiac catheter. I cannot put piercing door without knowing cardiac catheter. Ready? Let's go. Cardiac cath is an invasive test. Right here you see invasive, you know there's a consent. It is done in outpatient, meaning you don't want to drive yourself, right? Because you're going to be a little sedated. Sedated means you're going to be awake, but very sleepy. So you want somebody to drive you and be able to pick you up. You don't stay in a hospital overnight. It is about 6 to 8 hours. Probably 6 now. Now, the pre-procedure. Miss Sonia, why is cardiac cath done? Cardiac cath done for all disease, all heart disease. If I have CAD, cardiac cath. If I have angina, why would I do a cardiac cath? To see what is causing the chest pain. Si te bourgeois or clot. Cardiac cath. MI, cardiac cath. Heart failure, cardiac cath. Endocarditis, cardiac cath. PAD, hypertension. Kids, cardiac cath. Any question? So cardiac cath is used to do what? Information about the structure of the heart. The heart chambers, the valve, right? And the circulation. And also, if you had a man that broke your heart, it shows that too. And if you real evil, like you real mean, my show that. Funny. Okay, let's go. Cardiac cath, you need a consent. Now, Miss Sonia, where they gonna cut? First of all, who's in the room cardiac cath? Not a regular MD, cardiologist, a heart doctor. He does this. Not a nurse. He does this. Who will be next to him? A registered nurse. You see? Not LPN, registered nurse. Now, some LPN, some state, you got to train you. Because New York and those up north, LPN is a big thing. You know they get paid a lot of money. So some place they'll train you. But state of Florida, no LPN. Right? I need a consent. I need to know if you allergic to dye. Miss Sonia, why they give me the dye? The reason they give you the dye is once the doctor cut you, and he can either cut you here or here, he needs to make sure he can see 3D image. So he's going to instill a dye. Whoop. How's the dye going to feel? Flushy. Or some books say metallic. You see that? So we need to make sure cow are not allergic to dye. Now, what you will see they always have on the cardiac floor, Benadryl. They either going to make you sedated with Benadryl or they give you Xanax. They ain't going to give you big morphine. Not big stuff. Either Xanax or Benadryl. Any question? We cool? Now, stay with me. Now I'm on C. With whole food, 6 to 8 hours. And liquids, 4 hours. Right? Because you don't want the patient to vomit. Aspiration. You guys know that. Right? Because we're going to give them a little Benadryl. Right? Now, Miss Sonia, D. Document the client height and weight. A. Pukisa. Why would we document height and weight? To know how much to give. Because little people, small, little weight people. Like a Robin. Wait, Robin. Robin, stand up. Like somebody Robin that one of my legs bigger than her whole body. They gonna give her little Benadryl, little dye. Somebody like me, we need extra. Anyway, y'all wait when I come back January, baby. Yeah, I'm gonna go pow, pow. Pow. Yeah, I'm gonna have surgery. Y'all didn't know? Oh man, I don't talk that much. Yeah, I'm gonna go pow, pow, pow. Yeah. Wait till I come back, honey. I'm not. No, but I am going to have a gastric bypass. Not a booty. Now, excuse me, but not that. No, I'm going because of diabetes running my family. I just can't lose the weight. I work out a lot. Not the big one. It's called a sleeve. Very little. They make my stomach look like a banana. I hope I don't pray. Y'all, hey, simbale tu nenu na ulo. I'll come back. Y'all stuck like Chuck. Well, y'all better pray for me. Yes, and don't be getting me upset like that. This, what I did this one, ain't no good for my health. You stress me out. Yes. No, it's too much for me. Listen to him. Where that wife at? You heard he told me okay like that. No, it walk. Pienpe mal. Yeah. Okay, not diabetes. Yeah, you don't want that. Okay, let's go. Let's continue. They will inform the client that local anesthesia will be administered before catheter. Now, let me explain to you about the local anesthesia. I'm in a lab. I used to do this when I first started. That's where they put me in. And I'm going to tell you why they give the local anesthesia. They're going to cut you either here to get here, or they're going to cut you here to get in. That's why they sedate. They use lidocaine. Now, a lot of time they will give it to you IV, but they try not to. They either going to cut you here, right, papilla or femora to go in, right? So they cut you, so they got to use lidocaine. They go in, the doctor stands, the cardiologist, and the nurse is holding your hand and she's there with you. What is the doc? So the doctor will go, I'm in. The dye, you see the dye. It's like a camera, just like this. It's on TV. You see the heart. This whole time the patient is not sleeping. The patient talking to the nurse. The nurse will hold the patient's hand. Now you remember, something is inside of you, like a scope. So the scope is in you with this catheter, which look like a sesso. You know when your car, you leave your keys in the car? So guys, what can go wrong? The doctor straight, right, really fast. The doctor pokes something. So things can go wrong. So while the nurse watching, what is she looking for? Dysrhythmias. She looking for puncture. She looking to see if your blood pressure and heart rate, how your blood pressure, how your heart rate, how your respiration. That's why an LPN cannot be in the room, because we need good assessment. Not that an LPN cannot do that. You need the nurse to do this assessment. Any question? Right? Now, after this procedure, you see, inform the client that he or she may feel a fluttery feel, right? If the patient is on metformin or any diabetic drug, do you see why we have to stop it 48 hours before and 48 hours after? Why? The patient is at risk for what? Bleeding. Any question? Now, post-procedure, right? There it goes. Stay with me. NCLEX asks you, post-cardiac cath, what's priority? That's it. Post-cardiac cath, what's priority? Vitals. Hey, you see, we went there. All right, not yet. I didn't ask you, I didn't want you to go there yet. Post-cardiac cath, what's priority? Vitals. There you go. There you go. After cardiac cath, patient vitals are stable, right? Patient said, I cannot feel my leg. What's priority? Circulation. Do you see the difference between vitals and circulation? After cardiac cath, how is the leg kept? Straight. Why? Why? Why do I keep it straight? For the obstruction. Clot. Obstruction. Okay? After cardiac cath, what's the highest you can put me? 15 to 30 degrees. Why not high Fowler? Bull. Clot. DVT. Emboli. Now, NCLEX asks you, how often do you do the vitals? A, after surgery. After surgery, first hour. 15, then 30, and then 1 hour. NCLEX question. Okay? So if the nurse say 2 hours post-op cardiac cath, I checked the vitals 4 hours ago. She need further what? Okay, on my mama, papa, the exit, I get you. And I'm going to tell you where I get you. I get you all the time. Although I'm going to tell you I'm going to get you, I'm still going to get you. I ask you, which one the nurse says she needs, you will intervene? You put, checking the BP every 2 hours. That's good. Why would you intervene? You remember, it's every 4 hours is what? It's bad. It's too long. So I put every 2 hours. You say that. Miss Sonia, 2 hours is too long. The book tell you, first hour, 15 to 30 minutes. Second hour, you can do every 2 hours. There's nothing wrong with that. But you don't take it on my test because you say 2 hours is too long. You got to read the what? Scenario. Any question?
And the book doesn't even say.
And no, the book don't say that. But the Med-Surg book say that. Okay? Now, cardiac cath. Will I give the LPN to do the work? No. No. Cardiac cath. Can I send her home with an LPN? Yes. Is a cardiac cath, post-op cardiac cath, is she a person you're going to see first? Yes. I had a cardiac cath 3 days ago. Is she going to be someone you're going to see first? No. 3 hours she kind of stayed. 3 days ago, she's kind of stable. Cardiac cath patient who had shortness of breath doing the procedure, or cardiac cath patient who had hives doing the procedure, who went home and continued to itch, is she a patient you're going to see further? Yes. Yes. Any question? Yes.
I heard you say, this is not priority. This is a priority patient, right? That's what you said.
It's not a priority patient unless mettez more na question. For example, the one with the allergy. Post-op cardiac cath, the patient say, I feel a little pain. That's not priority. That's not a patient you're going to see first. Post-op cardiac cath, the patient say, hey, I'm having itching. She had problem itching and she went home with itching. She may go into anaphylactic shock. That you will see first. For you to take it first, I have to put a problem in the scenario. Any question? Okay? So far, stay with me. Med-Surg. I told you what is the disease, what blood test of the disease. I told you sign and symptoms of the disease, right? Right? Machine test of the disease. What's the med? You tell me the med. Bulgres. Anti-lipid. Stay with me. Anti-lipid to go home. I need a drug to give me in the hospital. Be careful. Hey! Woo!